Okay, it looks like people are still popping in. Thank you all for turning on the mute on your microphones. I appreciate that. So I want to welcome everybody this evening, those of you who are joining us live and those who are joining later via recording. We always appreciate connecting with you regardless of how we do that. If you're going to need a certificate of attendance for tonight's meeting, near the end of the meeting, I'll post a link in the chat box and you can use that link to fill out a form, and I'll be sending you your certificate of attendance tomorrow. So for those of you who don't know me, my name is Mary Newton. I'm the president of the Reading League Wisconsin. And I'm joined tonight, Katie, if you want to wave, I'm joined by Katie Kashabowski, who is the state lead for Decoding Dyslexia Wisconsin. And we have as our special guest tonight, Dr. Robert Newby. Dr. Newby is a recently retired clinical neuropsychologist. And rather than having a formal presentation, which we do sometimes with PowerPoints and the whole shebang, our goal tonight is just to have an informal discussion with Dr. Newby about evaluating children for reading disabilities, which is what he did for many, many years. And if questions occur to you as you're watching and you hear us discussing, please put them in the chat box and we'll try to integrate those questions into our conversation as we go along. So I want to start out by having Dr. Newby introduce himself and just talk briefly about his career and how he's still staying engaged in his retirement. So Bob, you want to take it away?
I will, and Bob's fine. So I worked for most of my career at the Medical College of Wisconsin as a pediatric neuropsychologist. And my favorite thing to be doing evaluations about were learning disabilities. And I've done research in reading disabilities. Other things that pediatric neuropsychologists do evaluations of range everything from attention deficit to autism spectrum to epilepsy to brain tumors and so on and so forth. In the past few years, I've been involved in a couple of private practices that I went to join after I left the medical college because they were people that I loved working with. And I still do maintain a presence at one of them called the North Shore Center, where if parents want to come talk to me or phone and talk to me with questions they may have or just looking for information, I do that for completely free. And you all are welcome to do that. And I might mention that later as more people show up.
Okay, thanks.
Oh, and I have two labs who may try to express their opinion during our session. And if they express their opinions, you don't need to listen.
And I have one cat who may express his opinion also. So we'll see how we do on the pet front tonight. So the way we've kind of set this up is I have a bunch of questions that I've given to Bob ahead of time, and we're just going to go through and have a conversation. And Katie, feel free to chime in as you feel. As you're moved to do so. So the first thing that I wanted to do, and I had a hard time sequencing these questions because you could do it in so many different ways. But the first thing that I think I wanted to look at was, we all know that kids can get a determination in school as to whether they have a specific learning disability that qualifies them for an IEP or a 504 plan. But beyond that, is it important to get an official medical diagnosis, which schools always tell us they do not do medical diagnoses? Is it important to get a formal diagnosis of a reading disability via an outside evaluation? So what do you think about that, Bob?
Only sometimes. The optimal situation is that you feel comfortable with what the school is telling you about your child's problems, and you feel like they're getting both good quality and enough quantity of instruction for the things that they're struggling with. That too often doesn't happen. And so that's one possible reason that you would go seek an outside evaluation, for instance, from a pediatric neuropsychologist or a child psychologist. You might also seek evaluations from educators. And the difference between those is something we'll get back to. If the school isn't providing services or is providing what you think are meager services, that's especially a reason for thinking about getting an outside evaluation. Public schools are required to pay attention to reports from outside evaluations, but they're not required to follow the recommendations or to agree with the conclusions in those reports. The most important reason to me for getting an outside evaluation is if you, as the parent, have questions about what's making your kid tick. And if you want to get more, I don't know if we can say to the bottom of it, but enough breadth of information and feel comfortable that the explanations you've been given make sense to you and that you have a good map for what you're doing, then very often, not always, an outside evaluation can help you with that comfort.
So sometimes we see, well, different types of reports coming out of outside evaluations and different people writing them. Sometimes the term dyslexia is mentioned in those reports, and sometimes reading disability or disability in reading accuracy, disability in reading fluency. We see different types of conclusions, if you will, that are expressed in a report. So can you explain what the guidelines are in the DSM-5, the DSM-5 being the maybe you can explain it, but it's those are the guidelines that you follow as a medical professional for doing diagnoses. And what do they say about reading disabilities? What do they say about dyslexia? Do you think that the word dyslexia belongs in an evaluation report, or is it helpful or unhelpful? So just give me like, how do you look at that?
So let's take pieces of that one at a time. And we'll ask people to mute if they are having child background noise. The science of dyslexia is very, very strong. And there's a good consensus among major researchers worldwide what the main components are: reading word accuracy and reading speed or fluency. There's also a very strong body of scientific evidence about things like
whoever's joined.
Yeah, we're having a hard
yourself?
time hearing because of muting. Maybe that's better. Nope, still background noise.
The administrator can mute people.
That's what I'm trying to get on and mute people who are not muted. For some reason, I'm not having good luck with that. Katie, I'm going to make you a co-host so that you can go in the participants. Okay,
as long as it's kind of quiet, I'll keep going.
Go ahead.
The thing that we don't have about dyslexia is an authoritative source, such as the federal government or state governments or the DSM-5, which is a manual published by the American Psychiatric Association that defines what you have to show to have dyslexia. It's not an official diagnosis. It's considered a medical diagnosis in some ways because often the corners of medical diagnostic books, one's called the ICD-10 that's used, ICD-11 now, that's used internationally, is the term dyslexia, recognizing that it has a scientific validity to it. So when you see in a medical report, such as a psychologist or neuropsychologist, or even a physician, that somebody has dyslexia, it's not clear what that means. It would be clearer if we had diagnostic criteria. How much of this and how much of that would have to be how impaired in order for that word to be used. But it means something general. And if the person is who's using the word is following the science, it means below expected reading word identification skills and or below expected reading fluency. How important is it to have that word in the report? Well, some consumers of reports, including school districts and including colleges and including providers of educational services, want to or require that term in the report. If somebody has a specific learning disability as determined by the public school system in basic reading, which is the reading accuracy, and or reading fluency, they have dyslexia. And so the evaluator could add that as an additional label. If the person has those characteristics, but it's not quite severe enough, they could have the pattern of dyslexia. And so if the evaluator is willing to have the word dyslexia in the report, whether they use it routinely or whether they are shying away from it because of the vague definitions and the vague diagnostic criteria, you as a parent can say, please put it in. We might be able to use it. And there are places where it can be useful. As Mary said, it doesn't usually open doors in the public schools, but never say never. There are public schools that will end up in the negotiation giving more service or giving somebody a plan if the term dyslexia is in there rather than it not being in there. And so that's why I'm saying if it does apply, then it's worth asking for.
I do remember looking at the DSM-5 and the way it's set up, and they talk about dyslexia being an alternative term that that a professional can use to describe what's going on with a kid. But it's pretty limited, and some of the things that we might think of as being, at least with respect to our child, as being included in that, in the universe of the difficulties that they're having, are not really included in the DSM-5 definition of dyslexia. It's strictly reading accuracy and reading fluency. And, when it comes to things like written expression and problems in math and, all sorts of things like that, that might be part of that child's broader picture of their strengths and weaknesses. Just be aware that if you are asking for, if you only want the term dyslexia used, you may be unintentionally limiting what technically that report is saying about your child. They might be limiting. Do you agree with that, Bob?
All this is very well spoken. The history behind this is that advocates of using the term dyslexia, including the organizations that are sponsoring this, have tried with both the federal government and therefore the state governments, and have tried with the American Psychiatric Association to get them to switch over and use the term dyslexia. It's not been successful. And the biggest reason for that is because of too many different people, including too many different professionals, using the term to mean different things. And so what's called specific learning disability in the public schools, what's called specific learning disorder in the psychiatric diagnosis, the DSM-5, has more specific criteria. And so that's what you're going to be finding more likely to be used as a kind of bottom line. The history of the advocacy groups not being successful doesn't mean that they're not still trying. It may be that the next version of DSM-6, for instance, would have something that is more dyslexia more central. They may say, for instance, which is scientifically true, we're still calling it specific learning disorder in reading accuracy and or reading speed or fluency, but it's also called dyslexia. The other things like spelling and like written expression and reading comprehension are best to view as downstream consequences of the basic reading difficulty, or as associated symptoms, meaning some children show those things and some children don't. The one that is almost always seen, and you guys know this as well as anybody else, is spelling difficulty. And in the International Dyslexia Association definition of dyslexia, spelling is a central piece. And so that's one that could be considered, along with those two reading aspects, to be a almost ubiquitous or essentially ubiquitous piece of it too.
Katie, I'm wondering if you could chime in, because you hear from parents a lot. I don't hear from parents as often as I used to. Are they wanting to see the word dyslexia used in an evaluation report, or is that not something that you're hearing so much these days? I've run into people who are, they ask me, where can I go to get an evaluation where they will use the term dyslexia? And I usually, my first question is, why do you want that term in there? Is there a reason that you need it? Do you think it's going to help you in some way, or would it be more helpful just to have the list of, you know, of all the profile of the student and all the things they're having trouble with, and the things that they're not having trouble with, and the degree to which they're having trouble? What does dyslexia add on top of that? And I know it's, for a lot of people, it's an emotional issue, because I know I've been told many times dyslexia doesn't exist, and that really gets under my skin. It makes me mad.
It does exist.
Yeah. So Katie, I'm wondering, like, can you chime in with what you're hearing from parents these days? Is dyslexia, mentioning that word, is it important?
Well, our own personal experience with both of my children have dyslexia. One is very severe and one is quite mild, and he's been remediated and he's reading back at grade level after remediation. My student that has severe dyslexia, she still struggles. And so she got the neuropsych first, and when she had the report written, it said specific learning disability in reading, parentheses, dyslexia. And that's just how our neuropsychologist writes, I think, all of her reports. Everybody I've talked to that has gone with her through her for an evaluation has had that written. You know, my daughter was at the point where she qualifies for special education services. My son would probably never have qualified for special education services, and he has the same thing written on his. But obviously all of those detailed scores are included in the neuropsych. And so if you brought that to the school, they could see all the assessment scores and they could determine the difference, and probably run their own diagnostic or assessment, or, you know, the Wyatt 4 or whatever they run. But I mean, usually parents do ask for the dyslexia word to be put in there. It's in our state statute. It's a non-statutory provision with the dyslexia guidebook. I think it's helpful for students, in particularly, just to not feel stupid. They can call it something.
Self-concept, yes.
I don't think they're going to go around saying I have a specific learning disability in reading, but when you say I have dyslexia or dyscalculia, I feel like it gives them some, I wouldn't really say pride, but more confidence in being able to explain to people what's going on. So for that fact, parents do look for the word dyslexia if they can get it written in there.
Yeah, Christine is asking, why do some people think that dyslexia doesn't exist? And I don't really know how to answer that, because there's been so much, you know, so much brain imaging that's gone on that shows that it exists. It shows the difference in the structures and functions in the brain of people who have dyslexia. I think it's because the term dyslexia comes with at least the feeling from some people in education that certain types of interventions then are called for. And if you identify something as dyslexia, you are opening yourself up to feeling that, or having people tell you now it's your responsibility to provide the types of interventions that have been shown to work for kids with dyslexia. And if you don't really understand how to do those interventions, or they're not in your bag, it's not what you've been doing, I think you may be hesitant to want to use that term. I don't think it's so much that they don't think it doesn't exist, but they just say it's too ill-defined to have any. It's a useless term because it's so ill-defined. I don't want to get too much more into that tonight. That's not the main focus of what we're doing, but anyway.
I mean, Mary, I like to explain to parents that, just because a student is diagnosed with dyslexia from an outside evaluation doesn't necessarily mean that they're going to qualify for special education services. What are your goals in getting special education services? Does your student, could they do okay with accommodations? Do they need modifications? Do they really need all their assignments kind of cut in half if they have to do a lot of written work? So, we try to really make clear that just because you have a diagnosis of dyslexia from an outside, you may not hit the requirement or the cutoff for special education services. And I think that's a really important thing to discuss with parents.
Yeah, no, I agree. And I think another thing, a lot of times this issue comes up when kids are in primary school and parents are looking at getting an initial diagnosis of something, regardless of what it's called. But as time goes on, I think that not that you have to have the word dyslexia, but having some type of a diagnosis or a track, whether it's through the school and showing in an IEP that from early on you needed these types of accommodations in order to succeed in school, whatever it is, whether it's a school paper record or a record of private evaluation. When you get to the point that you're taking high stakes tests near the end of high school, if you're taking advanced placement exams, you're taking the PSAT, you're taking the ACT, you're in college and you're looking for some accommodations, some extra time or whatever, or you're in the workforce and you're looking for some accommodations there. It is important to have some kind of track record. And when I would occasionally get a student who was already a junior in high school with nothing on paper anywhere, but clearly a student with significant dyslexia, significant reading disabilities, and then they were already at the point where they needed some documentation in order to qualify for important accommodations. And it's kind of hard when you get to that stage and you have nothing, no track record. So when parents say, well, I don't know what good it would do me to get an evaluation, or in school they're not going to do anything that's worthwhile for my child anyway, or I'm not going to be at a school, I'm going to be at a private school, or I'm going to homeschool, so there's not going to be anything that I'm trying to qualify for with a diagnosis. I said, well, think ahead a little bit, because you may want to have some type of documentation that's going to assist you down the road. I think that's kind of important not to forget. Okay, so I want to move on to our next question. It's kind of moving back to a more basic question, really, and that is, when we're looking at a child, regardless of whether we're looking in school or we're looking through a private evaluation, what kinds of skills and abilities or characteristics, what are we looking for in an evaluation? What kind of tests should we be giving, and what should they be measuring? Bob, do you have kind of a checklist or something of the types of things that you usually going to go in and look for?
Yes, the most important thing is an individually administered test of academic achievement, especially reading word recognition and reading speed. Other things that most of those test batteries also cover include reading comprehension, spelling, written expression, and different kinds of math skills, and sometimes oral language, such as listening comprehension and oral expression. Those are the different categories of specific learning disability and specific learning disorder as defined. The next thing that ought to be tested is dependent on the judgment of the evaluator. And it depends on whether the evaluator is taking a one-size-fits-all test battery approach, or whether the evaluator is wanting to just test those things that there are legitimate questions about. For instance, it's been traditional that an IQ test has to be part of an evaluation for learning disabilities, because the older definition of learning disabilities was that there's a discrepancy or a gap between somebody's IQ versus their skills in certain academic areas. Because the scientific evidence for that kept getting weaker and weaker in the end of the last century, in 2004, the federal government said, no, states can't require a school district to use that definition anymore. Interestingly, in Wisconsin, that definition is still operative because the alternative that the state has required, which is it's called response to intervention. A child has to be getting a certain amount of good quality instruction and not make enough progress and then still be low. If you're in a non-public school or if you're homeschooled, they can't do that. The public school can't do that because they don't have the ability to do that intervention and then see how it went. And so the old definition where an IQ test is part of it is going to be necessary in the evaluation. A lot of outside evaluators, if they're being thorough, still include an IQ test. A third area that's important to include, if you're looking at a broad picture of a student's strengths and weaknesses, is the layer under dyslexia, the language layer, which involves sorting the sounds. It's called phonemic awareness or phonological awareness. It's tasks like, can a kid get rhymes? Can a kid do this kind of thing? Say cowboy without boy. Or say can you say can without k? Or older, say spirit, can you say spirit without It gets to be more tricky with the more difficult items. Notice that none of these things have to do with the correspondence between print and sound, which is what you need to decode and read. And so they're not called phonics, they're called a more complicated name, phonological awareness, phonemic awareness. Most of you are probably familiar with this. A good thorough evaluation will include some tests of these skills. Now, beyond that, a flexible battery approach would say, well, do we need to test attention? I don't know. Does the child have attention and problems in everyday life? Do we need to test memory? Do we need to test fine motor skills? Do we need to test math, for instance? And many neuropsychologists, I would say most, and many psychologists will say, I'm going to give a standard set of tests for this outside evaluation to all kids, and it might take hours. It might take more than a half day. It might mean several visits. I have a grandson who just went through 3 visits with a psychologist to get that kind of testing, and each visit was several hours in the morning. So you want to be prepared for that. I was probably relatively unusual during my later years of practice in getting more practical and saying, I'm just going to test things where there's legitimate questions that will be answering for what's on the table. That's a long-winded answer to the question of what else needs to be looked at. There are kids where there are even more things that need to be wondered about. For instance, if their early language skills were delayed, might they still have some leftover of receptive or expressive language skill problems? Are there questions about their hearing? Are there questions about their basic vision? I'm not talking about eye movements or what's called auditory processing, which are more scientifically questionable kind of concepts. But you need to cover the basis of anything that's not known.
So would you say, regardless of where you're having this evaluation, if it's a privately arranged testing session, or if your child is being evaluated in school, I mean, it seems like they should be like the evaluation should include the same components.
It does not, it does not, and it should not. And here's the reason.
Okay,
The public school definition for specific learning disability is very scientifically sound in Wisconsin and very clear. And there are a lot of protests and whining about it, but that's just due to the fact that it's very difficult to implement. It's complicated. It's infinitely rational to say, don't test the kid first. If they're struggling in these aspects of reading, give good instruction for that with small enough groups, often enough, several times per week, for long enough, 10, 12, 15 weeks, and see if progress is made. And then the state, in its wisdom, and I think this was very wise, said, if not enough progress has been made, then start over and do another different intervention for the same intensity and the same time. And after 2 of those, if there still hasn't been enough progress made, then you test. But the only thing you need to test at that point to determine if there's a specific learning disability is the academic skills in question, the first thing that I mentioned in the test battery. And so therefore, school psychologists are legitimately, for their gatekeeping function, and they do have a legitimate gatekeeping function, not testing all those different areas. If you have questions about cognitive disability or intellectual disability or speech and language impairment, then other tests get added. But the school evaluation routinely no longer includes, for learning disabilities, without those other questions being on the table, other testing beyond the academic skills themselves. Now, bless their hearts, some districts will go ahead and say to their school psychologists, we want you to go ahead and we want you to go ahead and spend the time doing something more thorough, or perhaps we'll let you, even though it's expensive to us for you to do so. And that's wonderful. But the thing that's needed at the after intervention time is just the testing of the academic skills. So why do the outside evaluators do all the other tests? They want to understand broad pictures. They do want to understand patterns of strengths and weaknesses. And very importantly, they can't provide intervention and be seeing what the results of that intervention is. All they can do is to assess in their own judgment how good that program has been for that child, whether it's been through a school intervention or an out-of-school intervention. Has there been enough good quality intervention for us to say, nope, not enough progress was made?
and I think, yeah, I appreciate what you're saying about, it's definitely a different landscape since Wisconsin went to RTI as a means of, it's like you have to make it through the RTI before you get your testing. And it's definitely changed the whole landscape of what type of testing is done on kids in schools. I think that, what we see as parents is a couple different things that go along with that. And again, this is not the main point of our discussion tonight. We can have a separate discussion on RTI, but the first thing is that general RTI, if you're just talking about any child having any type of problem in a classroom, and let's get them before the problem gets too bad. Let's intervene and nip it in the bud. Well, there are no requirements for that type of RTI. So schools can do whatever they want to.
It's very underspecified, and
yeah,
that's an unfortunate piece of it. The quality is nominally required, but they don't really say, how do you do that?
right.
The school district judges.
Right. And you get to the point where if a child has been in RTI for a couple of years, which is very common, maybe the second part of kindergarten, first grade, second grade, get to the end of second grade, you're going, wow, my kids still can't read. They've been in RTI for a couple of years, and you go and say, well, I'd like an evaluation for learning disability. Then you find out that the RTI they've had up to that point doesn't count because there wasn't sufficient, the program didn't meet the definition of what intensive intervention is. There wasn't sufficient progress monitoring. So then they want you to start all over and do 2 more intensive interventions, and meanwhile, the clock is ticking. And I think that's when parents get really, really impatient and look for outside help to get the full picture of what's going on with my kid. And, you know, and a good evaluation report will have suggestions for the type of intervention that is likely to be effective with this child's pattern of strengths and weaknesses. And if you get that, you can look, even if the school's not going to give it to you, you can start looking outside for something that's going to take care of, you know, begin to take care of your child's problems before too much more time passes. So
You should also point out that other states allow the other way of diagnosing learning disabilities that the federal law allows states to do. Wisconsin does not. And so, for instance, Minnesota does, and that's called the pattern of strengths and weaknesses.
right.
And in those cases, the schools are still doing those more elaborate kinds of evaluations, looking at different things to see, is this different enough from this? And then we call it a learning disability. There's science behind that. I happen to think the science behind good RTI is much stronger than the science behind even the best pattern of strengths and weaknesses. But as outside evaluators, the pattern of strengths and weaknesses is all we have, and it does mean something.
Yeah, and good RTI, you know, it's like, well, I have to be honest, I haven't seen it too often. So it's
One other thing I'd like to say is I think Dr. Newby did a great job of, sorry, I think I said your last name wrong.
It's cool.
A great job of discussing the differences and how the school evaluations are very targeted and specific because they're trying to meet that specific criteria. And having had outside evaluation and a school evaluation, I just didn't see the scores and I didn't see what I thought I should see from the school evaluation. Whereas the outside evaluation gave me a more complete picture of my children. You know, like you could easily see their strengths and weaknesses in their report. And like my daughter has amazing spatial reasoning skills, which I think is it Famiko or Nadine Gabb say there's an inverse relationship between your spatial reasoning and your decoding. There's been studies that have been done on that. And you know, my son, I thought he wasn't listening to me and I thought his ADHD was very bad. Turns out he has incredibly slow processing speed. And I would have no idea if we hadn't done an outside evaluation. And that detail in that report was a game changer for even our relationship because he's just that much delayed. I have to think in my head and count and wait for him to respond because his processing is so delayed. So I think
these stories are enough to go ahead and get the outside evaluation if you can do it. It's a matter of cost. It's a matter of availability.
Yeah, if you can, but I mean, it depends on what you're looking for. So if you have a student that has a more severe case or there's something else going on, the outside evaluation, I feel, is going to give you a wider, a broader picture of your student. Whereas the purpose of the school evaluation is obviously very concentrated in that specific learning realm. So it depends on what you're looking at as a parent.
And again, some school districts do broader testing than they're required to by the law, but you can't demand that.
Mm-hmm. Yeah. So if a family decides like they just, you know, we need more information than we're getting through the school, or we're not getting information quickly enough through the school, we need to figure out what's going on here, and they want to do a private evaluation. What kind of credentials do you suggest that they look for when they're, you know, seeking out? You know, people go to all kinds of places to get evaluations, some of which I just like shake my head, like, what made you think that this person is qualified to do this? But Bob, what would you say as far as, you know, where do you look? How do you find a person who's really well qualified to do this for you?
The most reliable gold standard credential would be a PhD in psychology. So it's a psychologist. It doesn't have to be a neuropsychologist. Neuropsychologists tend to test a lot and they tend to test thoroughly. There are many child psychologists that do just as good a job in this particular area of learning disabilities. there are also master's level school psychologists, and there's licensing for master's level school psychologists in this state, who are in private practice, who also would do a job in the same league, but there aren't as many of those around. There aren't enough psychologists and neuropsychologists for the demand out there, but there is that other layer of a master's level school psychologist. Generally speaking, if you go to an educator, and it can be somebody who really understands their psychometrics, how to interpret tests conservatively and not out on a limb, some of those will be good quality for that slice of it, for the slice of the academic skills, and often for the slice of something else like, say, receptive vocabulary skills too, which is at least some estimate of general verbal skills, and also for testing of phonemic awareness or phonological awareness skills. But at the point that you get beyond the PhD in psychology or the master's level school psychology, you're getting into questionable credentials. And it's not going to be credentials that will be useful later on, for instance, for accommodations for college or for accommodations on the ACT. And so that's where the best thing to do is to find somebody who is a PhD in psychology, who does testing and who has a track record in this area.
Yeah, and you will find, like, through tutoring agencies, sometimes you'll find people doing what they call evaluations, but more of what they're doing really is it's like a skill assessment, and where does this child fit, and in my mind, are they behind where they should be? Are there things that I could teach them because they don't seem to know them all? So but it's like you said, that's not the type of evaluation that you're going to be able to rely on to prove a pattern of reading disability. Katie, what do you find these days? I know when I first started looking around for an outside evaluation, I had to ask people, like, where do you go? Because I had no idea who did this. And then it didn't seem at that time like waiting lists were so long. And one thing that I see online all the time now is, where can I get in? I'm on the waiting list for this place, but it's going to be a year before my child gets an appointment. Do you find that waiting problem is growing, or?
I think it depends. If people are going to bigger places like maybe UW Milwaukee, or they're trying to get into UW Madison, those places have longer waits. Dean has longer wait. Some of the private psychologist practices, people have been getting in a lot quicker. Both of my kids got in. They said it would be 6 months. I think we got in like 3 or 4 months. And I don't think the waiting list for that clinic has changed much. So it depends on where people are going. I mean, when I first asked, our pediatrician sent us to the Wiseman Center. And then, of course, the Wiseman Center in Madison says they only help students with autism. So then the Wiseman Center sent us this long list, and I called some people on there, and I just went into the one that we could get into the quickest. So I think it depends on your area of the state. I mean, obviously, it's going to be harder in more rural areas, and then try maybe some smaller clinics, and I would just call around and see where you can get in quicker. But some of those bigger places, it is still 2 years of a wait.
Yeah,
it's a supply demand thing. There aren't enough people doing it. Another place to check is the places that are training PhDs. So for instance, here in Milwaukee, the UWM and Marquette both have psychologist training programs, and you having graduate students do the testing, you might have questions about that, which is legitimate, but they are well supervised by the PhD teachers in the clinics.
And UW Madison does that too, and it's
Right.
a lower expense too, but
Right.
you still get a quality report. Yeah.
So related to that is, I always felt pretty lucky because our insurance paid for evaluations, and I know a lot of people's insurance doesn't cover it at all. I mean, so there seems to be a big, something definitely to look into ahead of time. But if you are in that position where your insurance isn't going to cover it, I know something Bob mentioned to me once, that I passed on to quite a few other parents, which really helped them because they had no insurance to cover an outside evaluation, is to use the school for what you could get from the school.
Mhm.
Like find out from the evaluator, what are the things that this child needs to be evaluated for, and what types of tests would match each one of these items that we're looking to evaluate, and then find out what can the school do. And if they can do a Woodcock Johnson or whatever, the things that they do well, get it done there, and then just make those results available to your outside person. Is that
Woodcock Johnson, by the way, is the name of one of those tests that was in my very first category. And there's others also, but sometimes the very same test or a very similar test will be done by the outside evaluator and somebody at the school.
Yeah, very true. There's a question in the chat that I have to go to because I see this a lot too. Somebody asked, when you were talking about the types of things that you assess for or refer for, what about convergence insufficiency of the eyes? Did you assess for that or refer for it? And how long do those interventions have to be? How many weeks? You want to say something about vision therapy?
I'll be brief. It's basically pseudoscience. If you want me to say more, I can. But there's too often when something doesn't have good quality science behind it, that there's a placebo effect. You may believe it's going to help, you see improvement, but it turns out that the improvement has examined very, very closely, nothing to do with that particular intervention. And this is a good example. There's a very small number of children that have convergence.
Yeah.
I remember the grandfather of ophthalmology at Children's Hospital, Dr. Rudham. I once saw a report of his that said convergence disorder, but it's very different from what you are looking at when you go to most optometrists that think that causes learning disabilities. It does not.
There is a, for anyone who's interested, there is a joint statement that's issued and reissued every so often by the American Academy of Pediatrics, American Academy of Pediatric Ophthalmologists, and a variety of these professional organizations, just saying that dyslexia, reading disabilities, it's a language-based disability. It's not a vision-based disability. It doesn't mean that there aren't children that might not have a vision problem. That's the first thing I did is I took my son to a pediatric ophthalmologist and said, he's having trouble reading, and I've read about convergence problems, and is that does he have anything like that? And he did the exam and he said, no, his vision is just fine. And that's not where his reading problem is coming from. His reading problem is a language-based disability. So, and once you get into the whole vision thing, a lot of times the people who are doing those evaluations are also people who provide vision therapy, which is quite long and quite expensive. And it's taking time and money that you could, if that's not the crux of the issue, it's time and money that you could be putting towards something that really is going to advance your child forward. So just be careful about that. All right, I did want to know, let's see, what else did I have on here? Scoring. So sometimes, I remember the first time I went into an IEP meeting and they had done some testing, and this was pre-RTI days. So they were actually doing a fair amount of testing, but I didn't know anything about any of the tests. And I went in, and the first time that I had seen any of the test results was when I sat down at the meeting and they plunked like 10 pages of, printouts in front of me with, each, different scoring metrics that they had used. And I had no idea what they meant. But Bob, could you just explain a little bit about different ways that scores are reported, and what's a good kind of scoring metric to ask for from an evaluator or from a school? I mean, we see things like, grade level equivalents, we see standard scores, we see percentiles, we see stay nines. What would you suggest that parents look for as something that will really give them an idea of how their child is doing?
Grade level scores are in one category, and they're not as sound as far as their reliability. For instance, the difference between being at a first grade level and a second grade level in reading is huge compared to the difference between at a seventh grade level and an eighth grade level. Does that make sense? Okay.
Yeah.
So you don't want to rely on grade equivalent scores. Standard scores, percentiles, and stay nines all translate to each other in a reliable way. You can get a chart that shows if you have a standard score of 90, you have a percentile of 25. And so any of those three are translatable in a direct way to each other.
Yeah. And what I find helpful about, to me, the percentiles are the ones that make the most sense, but then, you can convert it from a standard score to a stay nine to a percentile and, go back and forth. But
percentiles make the most sense to me too. And it's very fundamental. If you took 100 kids and tested them on their word reading accuracy or reading speed or any other skill, and they're from across the whole country, and among those 100 kids, there's one who's the weakest and one who's the strongest. That's kid number 1 and kid number 100. And you line them up in order. Kid number 50 is exactly in the middle. That's average. Kid number 25, 25th percentile, to kid number 75 is the average range. Okay. And so the question becomes, if you're not up to that 25th percentile and you're below average, how below average? What does it mean? What do you do with it? Does it meet the criteria, which in this state are the 12th percentile after RTI has occurred, to still be that low in order to get? And so once you get the basic crux of it, 25th percentile to 75th percentile average, we're looking at 25 and below as the meaningful how much, okay? That corresponds to a standard score of below 90. You don't have to know that or remember that. You just have to know that you can translate those things. And if you're like Mary says, and you're like me, then the percentiles are the easiest way to understand them. They may plunk a report down in front of you that has standard scores, and you can politely say to them, can you give me a chart or just tell me what the percentiles are for this? I can think about that.
Part of the problem with that, though, Bob, is our state law is written in standard deviation.
It doesn't matter. Standard deviations are also very readily translatable to all those other things. And so it's hard talking about it, but it's the same math.
Right, but it's not always presented in that way. And
No,
so it's important for them to say, the cutoff is this, but state law is written as 1.25 standard, below 1.25 standard deviations from the mean. But then when you get your scores, everything's in standard score, and so yeah, the percentile means more.
The way around that is very straightforward. It takes work. They may not cooperate in giving it to you, but you're essentially saying to them, I speak German. I need you to stop speaking Spanish and translate it to German for me. Okay. Mm-hmm. That's all it is.
Yeah.
That's hard work. That's frustrating. That doesn't always, fly, but it can be done. You just need the chart.
And also just to ask if it seems to be the pattern at the school where the rest of the team seems to have had all this data for quite some time and you don't see it until you walk into the meeting, ask for, I need it ahead of time so that I can go through and figure out in my mind what it means.
They have the option of giving it to you ahead of time, but they're not required to. Yeah. They're required to give it to you at the meeting. But you do have the option of saying, thank you, meeting's over, let's schedule another meeting so I can have time to adjust this. You can do that. It may seem to be an affront to them, but you can do that. Okay.
Sometimes you just have to. Okay, so we're kind of coming near the end of our hour. I see a lot of comments in the chat, not so many specific questions. If you have a specific question that you think that Dr. Newby could answer, that would be great. So somebody says, if a child is in special education, am I as a teacher always supposed to see a psych report. Well, if you're talking about an outside evaluation from a psychologist, I mean, it's up to the parent whether they're going to share it or not. I would assume that most parents would want to share those. Maybe I'm wrong. Maybe there are instances where they don't feel that would be beneficial.
The outside evaluations, whoever does them, are private information for the families, and they have the option of sharing it with the school. They are not required to. Just like Mary just said, they ought to be motivated to do so, but there's trust issues there too. Okay. If you're talking about the school psychologist, it's quite fascinating. The school psychologist may be the one to give the Woodcock-Johnson or the other achievement test, but it could very legitimately be a learning disabilities teacher that's giving that test. Psychologists' reports are no longer required for a determination of specific learning disability in the Wisconsin public schools since 11 years ago. It's quite something. And so you may see a psychologist's report and you may not.
Yeah. So one question that I just want to, one little point of discussion that I wanted to throw in at the end here is sometimes we get more than one evaluation. I think I was the queen of parental requests for more evaluations. I had so little trust, frankly, in my school district that I took my son outside for an evaluation every year to figure out what was going on, because sometimes the schools would tell me he was doing great, you know, or he made so much progress. And well, what data do you have to show that? And there was so little data. So I like to have the comfort of consistent reevaluation so that I could stay on top of something and not go for 3 or 4 years and say, oh my goodness, I missed all of this. Somehow he got way off track and now what am I going to do? But what would be, if you are only going to have say 2 evaluations, what would be a good time to do that? I'm assuming one time would be when you want an initially you want to know what's going on, right? You can't, that's something that you really can't delay. But once you've done that, when does it make sense to come back for a reevaluation to see what's happened?
The best answer is when there are questions on the table, when you're not sure the instruction is right, when you think there may be a need for different accommodations, when the school wants to end services and you don't think they should be ended. But if you don't have questions along the way, do it. If your child is planning to go on to schooling after high school, do it sometime within a 3-year window of when that person is, when your kid is going to be going on to the next thing, college, junior college, or whatever. Why? Almost all of those places require that there be an updated evaluation within 3 years of starting. All right. And so if you've only got the funds to do it twice, you'll want to get one of them in within 3 years of when they're going to be starting that post-secondary education.
Yeah. Do you find a lot of kids coming back, like they're in post-secondary education, but you know, maybe they're in and then they're out and then they're back in again and then they're out again, and then they're back in again. And, you know, so maybe 8 years have passed since they left high school. They still haven't finished their post-secondary education. And to qualify for accommodations, the university will require an updated evaluation. I mean, you can't necessarily rely on something that was done even at the very end of high school. They want something updated. And do you find those kids then coming out looking for private evaluations, or do colleges recommend, or do they have internal people that they would send you to?
They almost never have internal people. It's not a service that they typically cover the expense of. Because I always stopped at age 18 with rare exceptions, I don't know the answer to the question, but it's a legitimate need. And if it does come up, it's a need.
Yeah.
I do know that, Mary, some of the technical colleges, I believe Madison College has some testing that they do to see if you can get accommodations. But when you're in college, I believe you fall under ADA law, not you're not under special education. So, I've talked to some people at Madison College and I know they've done a great job there. So I suspect some of the other, and I've heard UW Stout is pretty great too. So
That's
Yeah.
pretty cool, and it's unusual, and so don't count on it. But if it's there, take advantage of it.
And Whitewater. Yeah. Okay. Yeah. So I mean, I would check out the student services, the student disabilities sections, areas. And I know that some of the I've heard good things about some of the universities. So I haven't heard bad things about getting evaluation either. So it's probably all good.
Yeah. Well, we've come to the end of our hour. I did put in the chat box the link. If you need a certificate of attendance, just click on that link and it'll take you to an extensive form where you fill out your name and your email, and I'll send those out tomorrow. But I want to thank Katie and Decoding Dyslexia for co-sponsoring with us tonight. And I especially want to thank Dr. Newby for sharing his expertise and his experience and having this conversation with us. So we really do appreciate you joining us, Bob. And
Dr. Newby has one more thing to say.
Okay.
In my retirement, I do like talking to parents, even though I don't like writing reports, and I don't do it anymore, and I don't test kids. But I'll talk to any parent who would like to talk to me about these kind of questions for free, and you can call me. Okay.
Do you want to put like where they should call you? Is that, oh, you put it in there. Okay. Is that your number or North Shore?
That's my cell number. Okay. You could call the North Shore Center, and that might be more orderly and reliable way of getting in touch with me.
Okay. Okay. But so many times it's just helpful, you know, if you're, even though you're not looking for a full evaluation, maybe you've had an evaluation, or maybe you're questioning whether you need one, or, you know, and to have somebody knowledgeable to bounce questions off of could be.
I love talking to parents, and it's pro bono. Okay.
Yeah. Thank you, Bob. That's very generous of you. So thank you to all of you out there for joining us tonight too. Our next Zoom event is Saturday, February 26th. It's a completely different topic. Reading League's Vice President, Amy McGovern, who works at CISA 9, will be discussing small group reading instruction. So if you're interested in that, you'll just, you know, if you follow our Facebook page, the information for that is on there. So I think we've reached the end of our evening. I want to thank everybody for joining in, and enjoy the rest of your evening. Let's go and watch the rest of the Olympics. Probably that's what I'm going to do. All right. Thank you very much, everybody. We'll see you later.